so I'm going to be talking to y'all about the national opioid crisis. By the end of this presentation, you will be able to know the signs of an overdose. You will know how to tell if your coworkers are taking opioids. Know the signs of an opioid abuse. What opioids do to your body, and you'll know about the national crisis, and explain how opioids impact healthcare. So, the United States is under a national opioid crisis. This is opioids. People abuse opioids. They are addicted to them and they misuse them. They overdose on them. Opioids use is a chronic illness involving the misuse or prescribed illegally or obtained opioids. How the opioid crisis started. The opioid crisis began whenever healthcare providers started worrying about patients' pain more. In the early 2000s, pain became the fifth vital sign, so they started worrying about pain more. Also, in the late 1990s, pharmaceutical companies told healthcare providers that opioids were not addictive, and that's when providers started prescribing them at greater rates. This led to patients misusing them, and before it became clear that they were actually addictive. In 2016, 11.4 million people misused prescription opioids. 130 plus people die every day from misusing opioids, either prescription or illegal use. 47,600 died from opioid overdose. 2 million people misused prescription opioids for the first time. 886,000 people used heroin. Heroin users, about 80% of them, the first time they used heroin, they first misused prescription opioids. So, opioid backgrounds. The opioids include synthetic or natural opioids. There's two kinds. Natural opioids is morphine and codeine. Synthetic is going to be like tramadol, hydrocodone, oxycodone, fentanyl, methadone, and then there's also an illegal type, which is heroin. Heroin is actually made out of the same thing that morphine is made out of. Opioids are highly addictive, and when they are misused, people can overdose on them very quickly. Opioids can make your brain think that you actually need the drug, your brain and body, for survival, so you crave the opioids. How opioids affect the body. Opioids bind to neuroreceptors in your brain, in your spinal cord, and other parts of your body, organs, that feel pleasure and pain. When they attach to these receptors, they block the pain. Opioids can cause constipation. They can also make you more sensitive to pain. Signs and symptoms of opioid use. You can have confusion, pinpoint, constricted pupils, nausea, vomiting, confusion, bloodshot eyes, poor coordination, and slurred speech. Signs of opioid use in coworkers. They are frequently or unexplained tardies. They may not show up to work. They may have more errors than normal. Ordinary tasks become very difficult for them. They are unreliable. They may refuse a drug test. They may wear long sleeves when it's inappropriate. And then signs and symptoms of addiction. People may spend less time with their family and friends. They may sleep more. They may not sleep at all. They may not eat, or they may eat more than normal. They may have nausea and vomiting. They may not take a bath, may not brush their teeth or change their clothes. They lose interest in normal activities that they normally do. They may be using other people's medications or borrowing medications from people. They may say that they lost their medications so they can get more medications from the doctors. They may be going to different doctors to try to get medications, that's called shopping. Signs of an overdose: your body can go limp. You may become unresponsive. Your body, your fingernails, toenails, or tongue or lips may become blue or purple. Your face can become very pale, cool, and clammy. You may not have a pulse, or you have a slow pulse. Your breathing may become erratic, or you may not be breathing at all. They may also be making like gurgling noises when they're choking on sputum. Risk factors for opioid use: they may be going to different doctors to get multiple prescriptions. They may be taking high dosages of prescription pain relievers. They have a mental illness or a history of alcohol abuse or other substance abuse. They may be living in rural areas or have a low income. Prevention: the U.S. Department of Health and Human Services focuses its efforts on 5 major priorities. They want to improve the access to treatment and recovery. They want to promote the use of overdose reversing drugs, which is Narcan. They're actually trying to make that more available. You can actually get that without a prescription. Go to the pharmacy and ask for it. They want to strengthen the understanding of the opioid crisis and provide support for research on pain management. And they want to advance better practices for pain management. In an effort to help with overprescribing opioids, the DEA created a prescription monitoring program called a PMP. This is an online database where if you are prescribed a narcotic from a doctor, or if you pick it up from a pharmacy, it tells the doctor when you were prescribed, where you got it, and who prescribed it to you. So it prevents over prescribing the medications. They also want us to have access to Narcan or naloxone. That's the opioid reversing drug in case of an overdose. It will reverse respiratory depression and hypoxemia. It can be purchased without a prescription. Financial costs to the economic burden associated with the misuse of opioids is $78.5 billion annually due to loss of productivity, medical treatment, addiction treatment, and then criminal justice. Treatment and recovery. Treatment is to stop the medication. Treatment is considered a lifelong process. Users are usually scared of withdrawal symptoms, so you can tell them that there is a drug called methadone that they can use to prevent some of the withdrawal symptoms. And then recovery can be hampered by judgmental healthcare providers. Withdrawal symptoms would be aches, fevers, chills, shaking, nausea, vomiting, and then insomnia. How can you help? It is important to not be judgmental. You should encourage them to get treatment. You should acknowledge that they are getting treatment and reward them for good behavior. You need to reach out and talk with people who you think might be using opioids. The faster the treatment, the better the outcome. You need to educate your family and friends regarding prescription drug use. Prescription drug use and overdose can be preventable. And it is important to provide support and prevention to treatment programs.